This position is going to go over a way to mobilize the back lateral aspect of the hip, along with promote a little bit of ankle inversion. So real quick, common issue that people have, right, is that their knee caves in or their foot turns out. That foot turn out can compress the lateral aspect of the ankle, and a lot of times that coincides with some weakness or tightness in the back of the glute. So sitting at the edge of a couch, edge of a bed, works pretty well. I let my foot rest off of the edge, and I don't need to jam my knee into a deep knee bend. Everybody's ingrained to do this with pigeon pose. You can relax a little bit so there's not a lot of pressure on the knee. First thing I'm going to do here is sit up nice and tall, and I'm going to turn a little bit towards this bent knee, so my sternum kind of follows the line of my femur. And first here, I'm just going to stay up tall as I come forward. And in doing that, I already feel a pull in the posterior lateral aspect of my hip / glute, right? If I bend at my back, I can bend and bend. I feel no stretch whatsoever until I get maybe like all the way down here. So that's just me moving a lot of my lower back, which is completely unnecessary. So I want to sit up nice and tall, keep my back very still, and I'm just going to bring my chest forward to feel that tension, right? So I may start off with just a pulsing in and out of this motion. And then once I find that that's okay and I feel this in my hip, I don't feel anything in my groin, which is not what I'd be looking for, I would start to add my ankle into it. So I'll come forward to where I feel a little bit of tension in this back corner of my hip / thigh. And then once I get there, I'll come down to my ankle, wrapping right down around the bottom of my foot, and I'll pull my foot a little bit down and in. So I like to think about turning the bottom of my foot to face the ceiling a little bit. I'm not jamming my foot up this way. It's a little bit down, and then I'm turning my foot a little bit in. And this really is going to pull right along this anterior lateral aspect of my ankle. I'm not going to pull very hard. I like to pretty much stick with, once I feel that tension in my hip, just a little bit of a pulse in and out. It's more of a down and in, trying to turn the bottom of the foot a little bit towards the ceiling. If this is something that's really stiff and there's no pain, it just feels incredibly stiff, you can pull a little bit harder and hold for 3 to 5 seconds. But for the most part, most individuals, I'm going to have them pull in and out of this, just because this tends to be a sensitive area, and if you yank on it too hard, it can make it more sore. So sometimes you're better off just going in more of a light in and out type motion. If you want a little bit more mobilization of the arch of the foot, and you have the hip mobility to do so, you can come over here and take this other arm, and after you get a little bit of a stretch in your hip, you can apply a little bit of downward pressure to mobilize the foot. But for the most part, as far as the version of this that I give the most, it's going to be feel the tension in the back of your glute and just very lightly pull in and out of this ankle inversion with a little bit of toe down position 3 to 5 times, and then back out. Then reestablish the stretch in the hip, chest up tall, and back out 3 to 5 times.